Genevieve, welcome back. How we doing?
Great. How are you?
Good. So listen, I want to talk about Russian rehab. We always talk about American perspectives on rehab, the Hazleton model, the 12-step model, but let's see how Russians do their business over there.
Alrighty then. Russia. Why not? Currently in Russia, there's a huge problem with addiction. In particular, many people who have severe alcohol and drug problems can't get help. Ever the embracers of the free market, Russian doctors have seen a global opportunity to exploit capitalism, make some money, and stop addicts from using. Here's how their method works. Keep in mind, they don't have the same medical, moral constraints and scruples that we have in the US.
Oh boy, so they have no rules, no moral constraints. So basically, we were taught in graduate school, if a kid is adopted from Russia or from Native American reservation, they should be assumed to have fetal alcohol syndrome unless the kid can prove otherwise. That's how bad the problem is over there. All right, next paragraph.
Okay, so there is a new pill that has been recently invented. It's gone through all the required clinical testing and is now determined to be 100% safe, effective, and with no side effects. It's reasonably priced, the cost is only $1, and if you take this pill, you will never, ever want to get high again for the rest of your life.
Magic rehab pill.
Yeah. Never, not once. You'll not and cannot get high or drunk after taking this pill. So, do you want it? Come on, raise your hand now if you're willing to take it.
So deep questions. So we're to Brighton Hospital.
I would have been like.
But watch this though. At Brighton Hospital, I was trying to figure out who's who, right? So I'm in the auditorium over there, and we got about 70 people, and it's the morning group. And I say, hey everybody, I pull out an aspirin pill. I got this new magical pill to try to figure out who's serious and who's not, right? Please raise your hand if you want to never ever get high the rest of your life. And so you're awesome because you raised your hand. But do you want to guess what percentage of the room raised their hand to want to never ever get high the rest of their life in an inpatient rehab setting? We're all diagnosed with a real drug problem.
And we're in an AM session, right?
Right?
AM session?
Yeah.
So I've been to rehab 5 times, so I'm really putting myself in the moment.
Yeah.
I'm gonna guess that 20% raised their hand.
You're being too tough. Half the group raised their hand. So 50% of the people that are in rehab want to be sober forever. No, but watch this. But half of them don't. Please continue.
Mm-hmm. All right, what about a pill that does the same but only lasts for a year?
I'm a compromiser. Some of the kids are 19 years old, right?
Okay.
They haven't had their fair share of alcohol, drugs, and heroin. And so how about just 1 year to get your parents off your back? Do you want to guess what percentage raised their hand to be sober for at least 1 year?
60.
You're almost there. 75%.
I'm hard on this.
Which means that 25% of people in rehab don't even want to be sober for 1 year. Whoa.
It's scary. There's that fear. I'll never, in the biggest emergency,
right,
or when I really need to control my feelings.
Right, and commitment.
Scary, super scary.
What's the other side going to be like? Please continue.
All right.
Like engage?
Well, I can gauge how serious anyone is about getting sober by their response to those questions. Regardless, let's continue.
Let's do it.
Antabuse.
I love that drug.
Antabuse. Well, I do too. I was like, it's worked for a lot of my friends. Antabuse is a drug that makes a person severely ill if they consume alcohol. If it has been available for a long time, or it has been available for a long time.
Yeah.
Anyone who has been on Antabuse can tell you that if you drink on it, you will feel like you're going to die.
That's bad.
If you want to hear a story, I'll tell you. It stops the metabolism of alcohol and the side effects are serious.
Yeah.
Chest pain, vomiting, severe headache, even seizures. You'll not want to drink on Antabuse ever again.
So here's a Brighton Hospital story for you. So I worked there for a while, right? And they used to have a program where you leave Brighton Hospital, and they give you a prescription for Antabuse on the honor system. Hey, as soon as you leave, do you promise to fill your prescription? And guess what? Lots of people didn't do that. So they got smart. They go, here's the deal. You got to be off this pill for at least 4 days to drink safely. So the last 5 days in rehab, you go in front of the nurse, and she puts the pill in your mouth, and you got to swallow it, and you got to move your tongue around just like you're in prison to prove that you took it. Well, one of my guys who was in Brighton Hospital on the second time was told by his wife, you can't come home unless you're on Antabuse because he already came home and crashed and burned.
May I ask you something?
Yeah.
Is my story the one you told me about the broccoli? Is this the broccoli story?
No, it's a different story.
Okay.
Yeah.
Continue.
All right. So this guy was very, very angry because he did not want to be on Antabuse because he felt it was a crutch. So when the wife said you have to be on the pill, he was taking it the last 5 days while he was in rehab. And when he came home, his wife said, take it in front of me every morning. So for about 20 days, he was doing that, but he noticed the wife kind of didn't really pay too much attention. So then he got really clever. He thought to himself, you know what? I'm doing really great. I almost got 30 days clean, and I kind of deserve to have a couple beers. So there's a half day of work on Friday. What I'm going to do is I'm going to leave work a little bit early, go to the sports bar, have 2 beers, wait 2 hours, come home, give my wife a really big kiss and say, do you see how good I'm doing? The problem is the reason why the wife wasn't worried about him taking the pill in the morning, she had her own prescription of Antabuse. And every night in dinner, she'd crack up a pill and put it in his dinner.
This is the broccoli story
So
to
when
me.
dude went to the bar to have his first beer, Genevieve, what do you think happened?
He got freaking
He got
sick.
rocked. But see, he didn't
Rocked.
put 2 and 2 together. So he is being taken off to the hospital, and they called the wife. And their first questions are, has he been drinking? And they go, how can you be so shallow? Your husband's about to have a heart attack. She goes to the hospital room. She goes, hey, buddy, have you been drinking? And the man says to his wife, is it all you care about? I'm about to die here of a heart attack.
Victim.
She goes, no, because I put Antabuse in your dinner. And he looks at her and he goes, how can you do that to me? And she looks back at him and says, how can you do this drinking to me and the kids? Next paragraph. So
Man.
in Russia.
I've told people that story, and it is your story. I don't
my
know why I
God.
said broccoli, but it's like,
There
you
you
know,
go.
dinner and breakfast.
That's
Okay?
some bad broccoli. There you
Yeah.
go. So in Russia.
So in Russia, doctors have a permanent way of stopping a person from drinking. For $1,000, you can go to the special clinic where they will put an addict, an alcoholic, on an operating table surrounded by 2 doctors and a couple of nurses.
Yeah, very dramatic.
Yeah. Especially if there's a really large room.
Yeah.
They have an IV in the patient, and there's a heart monitor beeping away. Here's what they do. They run an IV of Antabuse through the veins. Then they tell the addict that they've been injected with a drug that will cause them to die if they drink or use drugs ever again.
Wow.
In order to convince the person, they offer them a half shot of vodka. After sipping the vodka, the addict begins to vomit severely, flush red, and feels like they're having a heart attack. The medical team goes into full alert and puts the paddles on the chest, acts like the patient is about to die, and convinces the person, if you use again, your relapse will be fatal.
Yeah, and by the way, in that moment, that becomes real. If I was to say, Genevieve, we just gave you a pill just now, and for the rest of your life, you can't get high, you're gonna die, and you go like, yeah, Raj.
I used anyways. I did try that in real life. You
But
know
that pill's not gonna
you
kill
know
me,
this.
right? But if I put you on a table, right, and
Oh, yeah,
and
that's
I run an
dramatic.
IV, and you're like, oh my God, this crazy man just gave me something that's gonna ruin my life.
Well,
I
we
can never
need to
get
know,
high
right?
again, right?
We can never get high, but don't we need to burn ourselves on the stove a million
right.
times?
Yes,
Like it's
to realize that it's
insane how
hot.
much I connected this story. Okay.
Let's do accordingly.
Accordingly, most people after treatment don't drink or use drugs.
Magical.
Sorry to laugh at that, but it's like, they've been conditioned and convinced that drinking or using will kill them.
Right.
They truly believe it.
Yes, they do.
They've seen their own reaction. They don't want to die.
No.
They are terrified of relapsing. Interestingly, many of the patients in a year's time do very well.
Do very well, not
do
just well, very well.
Very
Okay.
well. They improve their relationships of family, get better jobs, get better health, get more education, and begin to thrive. Surprisingly, a new return back to the clinic. See what additional help.
Why would they want additional help? Please continue.
So a person with over a year sober goes back to the doctor and says, "Thank you for all your help and you've given me. My life is completely turned around. My wife is happy, my family is proud, and I feel so much better.
Okay.
I have more self-esteem than ever, and I become truly grateful for what your staff has done for me. But I've been thinking,
Oh boy.
New Year's Eve is coming up, and I would love to have a couple drinks to celebrate with my friends. My life has changed. I want to enjoy a little buzz, and I'm willing to pay. How much does it cost to have an antidote to the drug that you're giving me so that I can party again?"
Right. And so what does Doc do?
The doctor grabs his chin and says, "After all you've been through in the past, do you really want to have a few more drinks?" So it's really like, after
Yeah.
all you've been through in the past, do you
Yeah.
really want to have a few more drinks?
Right, right. And what does dude say?
Yes, please, I deserve it. Yes, please, I deserve it. I've earned it.
Right?
Okay, the cost is stop getting high. The cost to stop getting high is $1,000.
Reasonable, reasonable.
However, the cost to have it removed and get high again is $100,000.
Unreasonable.
Okay, who do I make the check out to?
You're kidding me. They were shocked because when it did to people in Russia, they could not believe anyone actually would come back. And when they did, they tried to play a little money game. Well, here's the deal. The antidote is available, but it's just so pricey. And they'd throw a number out like $100,000. And instead of a person being dissuaded, they would be like, okay, I can get a loan on that. How about a credit card? You know,
Oh, you'll do anything.
How about I mortgage my house? And that's the crazy thing about addiction is that once all the consequences go away, right? We don't see the reality of like what the real problem was. The reason why you had all those problems was because of drinking and drugs. The reason all those problems are all gone is because you stopped drinking and doing drugs.
Well, yeah, that little voice in our addict mind says, oh, I've been doing good for so long. It's okay. I can handle it now.
Yeah.
And how many times it takes you, that's up to you.
Right? That's right. Somebody said I went to rehab 24 times, but not 25.
I love that because I'm not ashamed. 5 times. One hand on it.
That's right. You're a miracle today.
Yeah.
Thanks, Genevieve.
You're welcome. It's my pleasure.